What are some of the darker effects COVID-19 has had that we don't talk about? Pediatrician here. We have had multiple babies and toddlers brought to the hospital by police for found alone in the home with caregiver deceased. Well, that's enough Reddit for me tonight. Going to go cry in a corner now. The serious mental health impact and the shifted routine perceptions. I still feel like going out of the house is a dream state and my house is reality. Wow, this is one of the most accurate ones I've read so far. The world is now our apt and everything else is semi-reality. So many people have been getting pets that veterinarians cannot keep up. There is also a very real chance that animal shelters are going to be overloaded with abandoned pets once people stop working from home. Cognitive decline, even in those who aren't infected, lack of stimulation, excessive stress, etc. People's attention spans and memories are shot. Their reasoning ability is dimmed, self included. This Christmas is going to be a disaster. I work for a major depth store that carries toys and we're expecting to be sold out of everything by like November. Even regular clothes and stuff. We're still waiting on some products to show up from factories that were supposed to arrive in like July. We've basically had 2 years of crippled production across the board, but because of shipping times, we're only really just starting to see it. Do your Christmas shopping now or yesterday. People that didn't get COVID but do have ongoing health problems were less able and less likely to get the ongoing care that they would normally get. What you're seeing now is an uptick in 911 calls and visits because their conditions worsened and now have become medical emergencies. The health crisis that this pandemic caused is much farther reaching than just the people that got COVID. Source: I'm a firefighter. I have lupus, an autoimmune disease. I was unable to see my doctor at all the last 18 months. While he still fills my RX, I have gone from 1-2 flares every couple months to 1-2 every other week. It's awful and there isn't really an end in sight for my location. In my opinion, the darker effect is definitely the people with other illnesses that couldn't get treatment because of the lockdown rules. Many people couldn't get life-extending radiation treatment and are no longer around. Somehow I feel there could have been a better alternative to no treatment. Absolutely this. When they say elective surgeries are being cancelled, they don't mean cosmetic surgeries. People aren't getting mitral valve replacements and other very serious surgeries. I've lost one friend to a stroke because his surgery was postponed, M42, and another to cardiac arrest because he couldn't get his old pacemaker swapped out, M35. Children of vulnerable parents with disabilities or immune disorders who are disproportionately affected by long COVID are now acting as carers for their parents, off the books, trying to care for their parents and go to school at the same time. Because of a lack of canvassing and the closure of charity shops in the UK, children's charities lost millions over the pandemic. Barnardus, for example, lost 65 million. At the same time, up to 31% of children in the UK are now living in poverty, exacerbated by cruel government cuts to services support. The government are now reducing payments for these families, relying on universal credit by £80 a month, while food and utility prices are skyrocketing. 911 dispatcher for a small town here. The amount of domestic violence calls I have taken has skyrocketed. It's beginning to seriously drag me down and exhaust me. I also help the local programs try to get food to families with kids. I broke down when I realized some kids only get food at school. As a dental student, I see lots of people who neglected their teeth who otherwise might not have regular cleanings, checkups, not returning for definitive treatment and having a temp crown on for 18 months. This is partly the fault of dental offices cancelling appointments indefinitely and never rescheduling the patients, but also partly patient fear of catching COVID from other patients, etc. TLDR. More people's teeth are more fricked up. My dentist said people have been grinding their teeth a lot more too. This is a bit embarrassing because I'm in my 20s, but lockdown made me develop hemorrhoids. It's common among PPL who sit a lot for their work, and because of lockdown I get less exercise. And here I am with FCK and hemorrhoids on top of all the stress and chaos of the pandemic. I cannot recommend Metamucil enough. You are never too young to get enough fiber. A lot of people get hemorrhoids when they are at any age because of medication. Also, pregnancy causes them. Don't be too embarrassed as you are not alone. People just don't talk about them. I haven't heard a lot of people talk about it, but I still have survivor's guilt. The guy in recovery next to me passed away in the middle of the night. We had our hospital dinner hours before and we had a great conversation. As just before we went to sleep he said, "Hey, I really like you, man. Once we get out of here let's get actual dinner." I said absolutely. Anything would be better than this stuff. Later that night, I heard his machine go off. We were blocked by curtains and heard the nurses and doctors come in and wheel him out saying to get the defibrillator. I don't remember much, but that has stuck with me mainly because I thought I was next. I figured I'd never see my wife, family, or friends ever again, so I was trying my best to come to terms. I didn't find the peace everyone says you find near death. Anyways, after 47 days 10 in the ICU, I was able to leave. Year and a half later I'm here telling you all about my experience. I do still think of that man often. I don't remember his name. I don't know what he looked like. I just know our conversations helped us through. Whoa, glad you're here to share that story. How much hearing impaired people were affected? My mother, who wears hearing aids, also depends on reading lips, especially in louder, busier areas. Hearing aids can have trouble sorting through complex noise situations. You can imagine what happened when everyone covered their mouths. Now she's more isolated than ever. Since then, I've ran into a co-worker who is also hearing impaired but doesn't want to return to office because while she can read lips on Zoom, she won't be able to if we mask up in person. They were an invisible casualty of this pandemic. I didn't realize how much I was relying on watching someone's mouth to hear properly. Now I have to lean without getting my face in someone's face when I have conversations at normal speaking volume or when there's any outside noises. Supply chain shortages. It's contributing to skyrocketing cost of living everywhere. Every time things shut down, it only gets worse. This one hurt right in my pockets. Also rent has raised so much. So between that and groceries I barely have any money left to pay for streaming services, much less go out. My parents started to help me out with medical appointments and we were way past that. Less cancer and other serious diseases diagnosed and treated. Less needed surgeries performed because of the hospital staff being reassigned to COVID wards. Less referrals written to not overwhelm specialists. In-person health services becoming harder to reach. So less conditions like skin cancer diagnosed. The health of all of us suffers, not only those affected by COVID. I'm a prosthetist and I'm not sure people are aware that amputation can happen post-COVID. I work in a small private clinic and we have about 15 patients who had various levels of amputation secondary to COVID. Would love to know the statistics. I know it's been mentioned, but my high school students are woefully lacking in terms of behavior and meeting social expectations. It's like they have no idea how to function at school. This group has been affected by the pandemic since grade 8, which is when work habits tend to take form. This will take a few years to rebuild. Yup, I was 15 and halfway through sophomore year when COVID craziness started and now I'm turning 18 and graduating in a few months and I feel like I'm still 15. I don't know what I'm doing. I don't know how to be an adult. I'm stressed for the future. Feel like I'm just staring waiting for nothing and honestly I'm not okay right now. People who were furloughed had time to realize they hate their job. I can only speak in service industry, but it feels like a soul-crushing job more than ever. I used to love bartending, and now I feel trapped by it. Everyone I talk to seems to feel the same. The money doesn't seem worth it anymore. Guests are worse and more entitled than ever, and staff shortages have made shifts harder and longer. It has left me with a sense of hopelessness, as it's the only career I've known, but I cannot imagine a future continuing to do it. My memory is trashed. I clicked on a movie in our recent downloads and said, "You wanna watch this?" My hubby was freaked because apparently we had watched this 2 days prior. He went through it with me scene by scene but I have no memory of it. I now frequently forget the door code in work. My mum is really going through some stress right now and I speak to her daily. Sometimes I forget the people she's talking about entire conversations and I feel like an awful daughter. Never had a memory issue before. This isn't on purpose. It's only happened since I had COVID, from which I was very ill for about a month. despite being 29 at the time, now 30, but my doctor's response is that nothing can be done because no one is researching the long-term memory effects yet, so I am just in limbo. Managers give me jobs to do in work and before I finish one I forget the other thing and everyone thinks I am an idiot. Having COVID fog isn't a legit thing yet, so most people just think I am an idiot. I have 2 degrees and I now struggle in a mediocre job. Lost my previous job, where I had responsibility to the pandemic. It sucks. The work environment has been rather toxic. I work in a company where some people have the option to stay home while others don't, and it has caused some resentment between departments. I see that resentment some too. People who had to come in were resentful that some got to work remote. Now they are making everyone come in some, and those who could work remote are resentful. Old folks getting cut off from their kids and social interactions. I think a lot of them are suffering in silence. A skyrocket in domestic abusers. Families are forced inside with one another, coupled with financial issues, or just people being stuck with abusive partners with nowhere to go. Also, increased alcohol consumption. I am a therapist working in bereavement and attached to a local hospice. The past 18 months have been brutal. The amount of trauma and instances of stalled or complicated grief responses I have seen have definitely increased. Not being able to mourn the death of a loved one properly, not being able to be with them as they die, not being able to visit them, not being able to hold proper funerals, not being able to hug each other or sit near each other when saying goodbye. These things are massively increasing the difficulties in people being able to process their loss and grief, even when the person has not died of COVID-19. We rely on these rituals, these mourning processes, these avenues of community support, to help us come to terms with and cope with loss. So many of these comforts have been denied to people, both to those dying and those who are being left behind. It has been a grueling and incredibly depressing 18 months in this field, and I believe that we are going to see a huge amount of unresolved trauma and complicated grief over the next few years. Dog rescues facing increased pressure as people start to return to work and find their dogs have horrendous separation anxiety due to lack of correct training. We adopted a dog in November. We lost one of our 2 dogs at the beginning of pandemic, and my husband took her hiking this weekend. He said she barked the whole way, even though she was fairly happy to be out, and it hit us that we honestly had not taken her to a lot of different places due to the pandemic. So she felt pretty insecure outside her normal walk routine. My brother, who works for DSS, said during the pandemic child abuse reports plummeted, which likely means unfortunately that rather than there being less abuse, there are less chances for people like teachers having a chance to catch and report the signs. Anecdotal evidence from a teacher here. Since we returned to in-person last month, it's been one report after another. Last time I called CPS I was on hold forever, and the guy who answered said sorry, busy day, and I said sorry, I've got 2 to report today. Addiction. I've recently gotten myself clean and am picking up the pieces of my life again. Prior to the pandemic I had a good job, was happy and healthy. Due to added stress, the loss of my job, worrying about my family, I eventually started using again at some point. One led to 2 and quickly I found myself horribly addicted to age again. I lost all I had built for myself. I saw tons of other people fall as well. Many haven't made it back. I'm glad you are on the right road again. Sending you strength. One thing I have noticed is a load of young adults who before COVID were young enough to be young people but are now considered adults. None of them have any idea how they are meant to be or behave. My brother turned 18 a week before the lockdown here in the UK. He is now late 20, almost 21. People see his age and expect him to be a more mature adult, but really he is still an 18-year-old in his head. I really feel for that age group. They have missed some massively formative years that show you how to live and interact in an adult world. His anxiety levels are off the charts and he has gone from quite an independent young person to someone who constantly needs confirmation and validation. I'm sure it's very similar for many people his age. Yup, this is me. I was early 20s, now I'm approaching mid 20s but still feel extremely unsure of what I should do in life, and TBH I don't feel like an adult even though I should be one by now. A general decline in people's social skills, especially for the introverted and young children starting schooling during the pandemic. For me, it's been far too easy to isolate. I literally do not have to go outside of my house except to take out trash. Everything is deliverable. A local laundromat even started cashing in on the craze briefly by picking up dirty laundry at customers' homes and delivering it clean. My depression and social anxiety have absolutely flourished. So I'm back in the office, but it was scary to see how quickly I acclimated to essentially being a hermit. If you can, at least try to get out for walks periodically. I found it helped some. My dad works in education, specifically related to technology. He says he occasionally logs on to K5 classes and it's an unmitigated shitshow. Teachers trying to sing the ABCs while kids completely ignore her. Grandparents accidentally turning the camera off. Broken Chromebooks left and right. Middle school is just as bad for different reasons. He's convinced that this pandemic will result in one of the most underdeveloped generations of kids in decades, and we'll be feeling the effects for quite a few years to come. We were watching The Office the other day and my 4-year-old asked why they were not wearing masks. We had to remind him that life used to be different. I can only imagine what is going through our children's heads. I was thinking about this the other day. 2019 is going to become a popular year to set TV movies during, simply because it's as advanced and futuristic a year as you can set it in without having to either realistically portray or completely ignore the effects of the pandemic. Personally, it changed my view on the world a lot. I was just finishing up college as the pandemic hit and literally spent my first year out of college sitting at home with no job and nowhere to go. Any post-college plan I had went right out the window. Now there's things that I consider that I never did before because I see the world differently. These include, not sure what to do with my life, not wanting to deal with so much BS from society. Ultimately, I've realized just how fricked up we all are and how I just want to live my life and not be bogged down by so many societal constructs. It kinda ruined my last year and a half at college, right after I'd actually made friends and sort of figured out what I was doing. The number of people who had just sunk their entire life savings, second mortgages on their homes and their kids' education funds into that amazing new business that was going to be a surefire hit and make huge profits. Then within a month all the COVID lockdowns started. Thousands upon thousands of folks had their life dreams and futures utterly crushed, and are still just looking around themselves in shock at the craters they are sitting in. My co-worker, grocery 2 total now in 1 year, killed themselves recently. So mental health and addiction. They also lowered our wage during the pandemic, so that's cool. Greed is another one. The hospital protocols. My father had to have emergency open heart surgery in November to save his life and we couldn't be there with him at all during his recovery in the hospital. That was the hardest part for both him and my family because we was alone and miserable. And then my grandmother was diagnosed with brain cancer in December and we couldn't be in the hospital with her when she was diagnosed and she was all alone when she was told she had a terminal illness. Sad stuff, man. Well, everyone else has mentioned mental health, but what I think is worth pointing out how COVID massively accentuated political and social divisions within Western countries. Along similar lines, it's exposing how poisonous social media platforms can be. I worked for 10 years to get my anxiety to go away. 10 long years of exposure therapy. Now I'm back to square one. Panic attack as soon as I walk out the house. 10 years of work. For nothing. I have never felt my depression this bad. Not down the drain. I bet. It will take way less time to get back to where you were than when you started. I bet with proper exposure you could do it in a year. Your body won't forget. It just retread itself into an older pattern. But the tread of the new pattern is there and won't just disappear. I believe in you. When people got laid off, they didn't know how bad their mental health is until they don't have work to distract them from it. Dead bodies in freezer for months. Doesn't matter what they died from, they'll sit there until their funeral. Amount of misinformation going on that destroyed friendships and families and even lost our lives. Increase pediatric obesity. The rate of increase in pediatric obesity doubled during lockdowns according to CDC. Wow, I hadn't thought of that. I know so many adults who have gained weight, so it makes sense. The overwork and overstress of healthcare providers, making a lot of them leave the line of work. We are talking about experienced people leaving and never looking back. means a lot of the people replacing them aren't being trained properly. I know in my city we are getting a ton of newbies on the street with poor patient care. Yeah, I left my field in Jan. COVID was the final straw. Every Thursday when we clapped for our heroes, the NHS freaking infuriated me. The same PPL who vote for politicians who don't believe I deserve a decent wage were the ones out clapping. Frick right off. The increase of echo chambers on social media. Yes, Reddit is included. Echo chamber, an environment in which a person encounters only beliefs or opinions that coincide with their own, so that their existing views are reinforced and alternative ideas are not considered. It will be decades until the effects on the psychology and economic chances of current children come to light. In some countries, children miss 2 school years with only backbone online and TV options to catch up. Children have been growing up with constant warning to not get too close to other people, sanitize everything and wear masks. Do they learn how to read a stranger's mimic? Do they focus on the eyes instead of the whole face? Older children experience a tsunami of hatred, mistrust, misinformation and division both in their families and their countries. How fricked up will they be once they are allowed to vote themselves? I'm quite glad that I don't have children and don't have to worry about their long-term coping. 114,000 US children are now orphans because of COVID. Around the world, an additional 1.5 million kids have lost their parents, grandparents or other caregivers to COVID-19. Every 12 seconds a child under the age of 18 loses their caregiver to COVID-19. That's very dark. Guide dogs. Many guide dogs forgot how to be a guide dog during the pandemic because they didn't need to guide their owner anywhere. A YouTuber called Molly Burke has had to retire her guide dog early because of it. It's something I don't think a lot of us would take into account, but many with guide dogs have suffered from it. Frailty in the elderly. We've seen a lot of elderly people coming into acute hospitals who've had a massive deterioration in functionality, especially those with dementia. Without their regular routines, exercise and social visits, they've almost certainly lost years of their lives. A lot of people, including myself, suffered from eating disorders in quarantine, another branch in side effects to do with mental health. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.